Let's talk about the silent epidemic of chronic pain, with 51 million people suffering, which is getting louder and louder. What can be done besides taking a pain pill and waiting for the symptoms to reappear? Surprisingly, chronic pain is the #1 leading cause of disability in the United States. According to the Centers for Disease Control and Prevention, there is an estimated 21% of adults that have chronic pain. This silent epidemic affects individuals of all ages and backgrounds, significantly impacting their quality of life. Whether it is from back pain, neuropathic pain, fibromyalgia, arthritis, or migraines, it is debilitating and leaves a huge impact on one's life. Many individuals with chronic pain experience psychological distress, such as anxiety and depression. Additionally, chronic pain can lead to significant limitations in daily activities, work productivity, and social interactions. It is becoming more and more clear that chronic pain is a major contributor to disability claims. The Social Security Administration lists conditions like arthritis, fibromyalgia, and back pain as common reasons for disability benefits. Treatment for chronic pain has become a challenge with providers and what they can offer. The average medical student spends approximately 9 hours on pain education, which is barely a day's worth of lectures for such a massive and debilitating problem. Is there any wonder as to why people are turning to alternative therapies when they're not getting the help they need from traditional medicine? There are limitations to conventional treatments. We can also go down the road of pharmaceuticals and surgical intervention, but is that the best solution for you if you are that patient with chronic pain? We all know that opioids are very addictive, but have our providers really discussed all the side effects in detail when offering them? More than 50% of patients prescribed opioids find the side effects intolerable and even ineffective. Opioids' lower immune response can contribute to traffic accidents and fatalities, increase the incidence of falls in seniors, and can cause psychosis in vulnerable adults. It can even increase pain levels over time, which is called hyperalgesia. Hyperalgesia happens when the nervous system basically freaks out and amplifies pain signals. It's a tough reality. It really makes you think twice about just popping a pill. But when you're in pain and have not been told about any other alternatives, there's not really a choice but to keep taking those medications. All meds have limitations in terms of their side effects, true effectiveness over time, and risks. Gabapentin and Lyrica, for example, are commonly prescribed but offer pain relief for less than 25% of patients, but do have unfortunate side effects including brain fog, anxiety, fatigue, depression, mood swings, and memory issues. The long-term effects of an increased risk of dementia are now being studied and should be considered as well. So, where do we go from here? What are the alternatives? That's where open dialogue with your provider becomes critical. Understanding the underlying problems and working toward a goal of getting to the actual root of the problem versus temporary pain relief. With all its challenges in short and long-term side effects is key. There are new therapies being utilized every day, and we should never be afraid to advocate for ourselves. Patients can find it difficult to ask questions to their doctors, but then get home and wonder why they never brought up alternatives for them. Was it because they didn't know about them, or if they would feel confident in referring someone for another option of therapy? Physical therapy, chiropractic, acupuncture, nutritional counseling are therapies that could and should be under consideration. While there is clearly not one therapy for everyone, there are options that could help the patient in chronic pain. Let's discuss soft wave therapy in more detail and see if it could be an option for you or a family member in significant pain. Soft wave therapy has recently come into the world of pain relief for what it is able to do at the cellular level. It encourages the growth of new cells, kind of like giving your body a little nudge to activate its own healing powers. It's showing a lot of promise for numerous conditions, including musculoskeletal pain, joint pain, sports injuries, plantar fasciitis, neuropathy, and without the side effects of taking medications. Many patients develop long-term problems with scar tissue. Soft wave therapy can actually help break down scar tissue and then encourage the production of new collagen, which leads to more flexibility and less pain. So it's not just masking the pain, it's actually fixing the underlying problem. That could lead to major life changes for millions of patients suffering. This video is not about choosing sides between conventional medicine and alternative treatments, but rather establishing relationships between them for the millions of people suffering with chronic pain. It's about finding the right combination for each person and offering options to them. It's not a one-size-fits-all type of treatment, like having a toolbox full of different tools and knowing which one is best for the job. There are more and more physicians reaching out to different therapies for their patients and integrating chiropractic, massage therapies, acupuncture, and nutritional therapy in their care plans. Bridging the gap in care is what is needed to facilitate a successful outcome for those in pain. If I was a provider and had a family member in pain, I would want that dream team taking care of my loved one. Reaching out to treatments that could alleviate the pain, getting to the cause of that pain, and hopefully allowing them to live a life they had before. I would want them to have options before jumping into pain medications, which typically leads to a lifelong prescription for lack of other options. More medical schools are starting to include integrative medicine in what they teach, which is a huge start. It's a cultural shift in embracing the individual and understanding where they're at and what they need. Having a personalized approach for a patient with chronic pain is what is needed. Of course, one therapy is not the answer for everyone, but when reviewing softwave therapy and its studies, it does deserve a hard look. If you would like to speak to a healthcare professional near you regarding soft wave therapy and have a one-on-one consultation, please contact us at info@wellnessin360.com. We will also have the address for you in the comments section. You can simply leave your name and contact info, and that healthcare professional will reach out to you. It will not be a sales rep or a receptionist, but rather the actual practitioner that will do a consultation for you over the phone, and again, at no charge. This therapy may or may not be a good option for you, and there is no sense in wasting your efforts if you are not a match. But the phone call is very valuable, and there are zero fees. If soft wave therapy is not a match for you, they can work toward a different direction or referral for you, and one that is specific to your needs. If you found this video helpful, please give us a thumbs up and subscribe to our channel for more pain relief innovations. We are on a mission to help individuals get rid of their pain. In good health, we will see you next time.